Good afternoon, America. This is Callie.
Hi, Callie. I'm Debbie Oval with HealthNet Medical Clinic. How's everybody doing? Well, I hope.
We're doing good.
Awesome.
The purpose of our broadcast here today is to spread awareness in our San Antonio area about our opioid use addiction. So we're just starting off with a couple of general questions.
Awesome.
Our first question is, what exactly is our Suboxone program?
Our Suboxone program is a fantastic new program in the community, relatively new. We've been at this a couple years, and it's very, very successful so far. Sometimes we have dropouts. We're a little strict, but it's to help people kick the opioid habit with an outpatient medication and psych counseling.
Perfect. So do you take insurance?
Yes, we do. Yes, ma'am.
Good. Perfect. So how exactly does it work? How do patients, do they take the prescription? How does it work exactly?
Well, they come in. Usually they have Googled us or looked up a doctor. Maybe their doctor didn't take insurance, or maybe they don't see them, or maybe they just came out of a rehab program. But they find us sometimes referred by friends or relatives. And they come in. We do a lot of screening, get a lot of lab tests. We do a urine drug screen, of course. And we'll go ahead based on what they've been taking already, whether it's heroin or maybe they've had prescriptions even, or they had an accident and they were on pain medicines, or they got into grandma's pain medicines, or however it started. We will start Suboxone as an outpatient based on the level of drug that they've been taking already. And then we got rules. We got a lot of rules.
Yeah?
And
what are those rules?
Well, the rules are things like they need to keep their appointments.
Right. So they got to show up if they want to get better.
Exactly.
Right.
Yes,
okay.
ma'am. Exactly. And then they have to pay their copays for their insurance. They need to come back, in a week, and 1 to 2 weeks, usually a week, to check on their lab results. And they must have psychological counseling. That's like one of the number one
What
things.
exactly does the psychological counseling do?
Well, the psychological counseling, basically the opioid dependence starts with pain or something, a lot of times emotional pain in the brain. And the brain is where all the mood receptors and the feel-good receptors and everything originate. And sometimes they've used drug to get those receptors to work.
Okay.
So it really revolves around what's going on in the brain.
Okay.
So they can take medication. Suboxone helps, keep them from going into real steep withdrawal, keep them out of the hospital. But they've got to work on the psychological problems that they have. And a lot of people say, I'm not addicted, I don't have any problems, I don't need to go for therapy. And we'll say, well, it's required.
Yeah.
So, and then we do a referral.
You got to address the problem if you want to fix it, right?
Yes, absolutely.
Perfect.
Absolutely.
About how long do people take Suboxone?
Well, we've had people up to a year. Some people come in to us because they want to continue their recovery, and some, we have a few patients that have been on Suboxone for many years, 10 years. Some people want to fast track because maybe they're going into the military, maybe they're workplace, or maybe they're just anxious. But we'll work with the patient as long as they're coming for appointments, urine drug screens, going for therapy. We'll work with the individual.
Perfect. So you heard it here first. As long as you show up, we'll get you right.